Anterior MWM. Purpose: to reposition the glenohumeral joint in a posterior-anterior direction while the patient lifts his or her arm in forward flexion. Patient position: sitting with head and shoulders in axis. The therapist should correct scapular displacements before performing the exercise. Therapist position: ipsilateral to the shoulder you are treating. Hand placement: place a thinner eminence of your right hand on the posterior face of the patient's right humeral head and encircle the posterior lateral face of the shoulder with your fingers. Place your left hand palm anteriorly on all of the face of the pectoralis, making sure the space at the level of the glenohumeral joint is free. Procedure: mobilize in PA direction with a thinner and hypothenor eminence of your right hand, following the direction and the axis of the glenohumeral joint. Stabilize with your left hand and look for the correct angle to reposition the glenohumeral joint with your right hand. Stay in this repositioning position while the patient performs anterior flexion movement of his or her arm to the extent that is pain-free. Perform 6 to 10 repetitions and then reassess pain complaint or movement dysfunction. Notes: it is important to maintain the immobilization on the glenohumeral joint and the scapular repositioning throughout both forward and backward movement to and from the initial position. Apply changes to the force vector on the accessory movement until you find the force that reduces or eliminates dysfunction. Make sure you apply an appropriate force and direction in repositioning, since an excessive force or an incorrect direction may cause pain and limit the application of the exercise.